Are you thinking of having a cosmetic procedure? Whether you're considering breast implants or a non-surgical procedure like laser and intense pulse light, IPL, it's vital that you do your research.
Very often people think laser treatment is a miracle cure and can just vanish their problems without any risks, no scarring, and that's really never the case.
This series looks at real-life stories with accurate and useful information to get clued up on cosmetic procedures. Let's talk laser and light.
Well, I struggled for a long time when I was young in high school with really, really bad skin, really bad acne, like all of that. Even though it leveled itself out when I was older, it's still definitely a huge part of what I value, having clear skin and taking care of myself and looking after it. So I've had about 10 laser light therapy facials, basically. I would say research your technicians, because I did have a technician that clearly didn't know what she was doing and like burned the side of my face. But I didn't ask beforehand, how many times have you done this? I just was like, oh, I've done this about 6 or 7 times. They know what they're doing. So I'd say try to see how experienced your technician is. I think now I'll be doing more research if I want to get other procedures in the future.
Common treatments can include laser hair removal, tattoo removal, skin tightening, or treating vascular or pigmented lesions. Some effects are permanent. Other treatments claim to stimulate renewal of collagen, so the effects may be short-term.
The laser and IPL sector is very complex. So a good place to start would be go to a reputable practitioner, maybe go to more than one practitioner to try to get differing opinions, understand the professional qualifications of the person practicing. Are they a medical doctor? Are they on a specialist register? Some good questions to ask before you engage in a treatment would be, who is the practitioner? How long have they been doing the procedure? Do they usually have good results? If a practitioner is using those modalities to treat disease and to treat medical conditions, then they're regulated by the CQC, the Care Quality Commission, and they have to be on a clinician specialist register. And for me, a critical question is, if something goes wrong, what will you do for me? Because we often see patients who have really been abandoned by the clinics with dire problems and really very distressed because they can't get the support they need at the institution or the clinic where they were treated. The patient has to make a decision, a risk management decision that's individual, but I think getting more opinions can be helpful, in understanding the exact qualifications of the person doing the procedure is critical.
Lasers are a medical device that emit light with a specific wavelength and direction. Different wavelengths can be used to target different depths within the layers of skin. All cosmetic procedures carry some level of risk and can impact on both your physical and emotional health.
With cosmetic procedures, patients can be very vulnerable and have a very emotional issue with their skin problem. This sometimes leads to unrealistic expectations and irrational thinking, which inevitably can result in disappointment.